Welcome back to MCQs Master 101. In today's video, we're breaking down 50 high-yield cardiac Nclex questions that every RN candidate must master. These are clinically focused, exam-tricky questions covering heart failure, arrhythmias, myocardial infarction, ECG interpretation, and life-saving cardiac medications, all explained clearly in Nclex style. If you want to avoid common cardiac Nclex traps and boost your confidence for exam day, stay with me till the end. Let's get started. Question 1. A client with heart failure presents with crackles and dyspnea. Which medication helps reduce preload? A. Digoxin. B. Furosemide. C. Metoprolol. D. Lisinopril. Answer. B. Loop diuretics reduce circulating volume, decreasing preload and pulmonary congestion. Question 2. Which ECG change is most commonly seen with hypokalemia? A. Peaked T waves. B. Prolonged PR interval. C. Flattened T waves. D. ST elevation. Answer. C. Low potassium causes flattened or inverted T waves and U waves. Question 3. An atrial fibrillation client is at highest risk for which complication? A. Heart failure. B. Myocardial infarction. C. Stroke. D. Cardiac tamponade. Answer. C. Atrial fibrillation promotes clot formation in the atria, increasing stroke risk. Question 4. Which medication is first line for chronic stable angina? A. Morphine. B. Nitroglycerin. C. Furosemide. D. Heparin. Answer. B. Nitroglycerin relieves angina by dilating coronary arteries and reducing preload. Question 5. A widened pulse pressure is most associated with which condition? A. Aortic stenosis. B. Mitral regurgitation. C. Aortic regurgitation. D. Pulmonary hypertension. Answer. C. Aortic regurgitation causes increased systolic and decreased diastolic pressure. Question 6. Which lab value is most important to monitor in a client receiving digoxin? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer. B. Hypokalemia increases the risk of digoxin toxicity. Question 7. Which symptom is classic for left-sided heart failure? A. Peripheral edema. B. Ascites. C. Pulmonary crackles. D. Jugular vein distension. Answer. C. Left-sided failure causes pulmonary congestion and crackles. Question 8. Which finding indicates cardiogenic shock? A. Warm skin. B. Increased urine output. C. Hypotension. D. Bradycardia. Answer. C. Cardiogenic shock results in poor cardiac output and hypotension. Question 9. The priority nursing action for acute chest pain is to A. Obtain ECG. B. Administer oxygen. C. Give morphine. D. Draw cardiac enzymes. Answer. A. Obtain ECG first, then oxygen. Question 10. Which medication reduces mortality in heart failure? A. ACE inhibitors. B. Calcium channel blockers. C. NSAIDs. D. Antiarrhythmics. Answer. A. ACE inhibitors reduce remodeling and improve survival. Question 11. ST elevation on ECG indicates A. Myocardial ischemia. B. Myocardial injury. C. Myocardial infarction. D. Ventricular hypertrophy. Answer. C. ST elevation reflects acute myocardial infarction. Question 12. Which condition causes Beck's triad? A. Heart failure. B. Cardiac tamponade. C. Pulmonary embolism. D. Aortic aneurysm. Answer B. Beck's triad includes hypotension, JVD, and muffled heart sounds. Question 13. Which drug is contraindicated in cardiogenic shock? A. Dopamine, B. Dobutamine, C. Metoprolol, D. Norepinephrine. Answer C. Beta blockers decrease heart rate and contractility, worsening shock. Question 14. Which valve disorder produces a holosystolic murmur? A. Mitral regurgitation, B. Aortic stenosis, C. Mitral stenosis, D. Aortic regurgitation. Answer A. Mitral regurgitation causes a blowing holosystolic murmur. Question 15. Which lab marker rises earliest after myocardial infarction? A. Troponin, B. CKMB, C. Myoglobin, D. BNP. Answer A. Troponin is the earliest and most specific marker used clinically and on Nclex. Question 16. Which ECG rhythm requires immediate defibrillation? A. Asystole, B. Ventricular fibrillation, C. Sinus bradycardia, D. Atrial flutter. Answer B. Ventricular fibrillation is a lethal rhythm requiring defibrillation. Question 17. Which assessment finding is expected in right-sided heart failure? A. Pulmonary edema, B. Crackles, C. Ascites, D. Orthopnea. Answer C. Right-sided failure leads to systemic congestion such as ascites. Question 18. Which medication prevents platelet aggregation after MI? A. Warfarin, B. Aspirin, C. Heparin, D. Alteplase. Answer B. Aspirin inhibits platelet aggregation and reduces mortality. Question 19. A prolonged QT interval increases the risk for A. Atrial fibrillation, B. Heart block, C. Torsades de Pointes, D. Sinus tachycardia. Answer C. Prolonged QT predisposes to torsades de Pointes. Question 20. Which condition causes pulsus paradoxus? A. Heart failure, B. Cardiac tamponade, C. Myocardial infarction, D. Hypertension. Answer B. Tamponade causes exaggerated BP drop during inspiration. Question 21. Which medication is first line for acute pulmonary edema? A. Digoxin, B. Furosemide, C. Propranolol, D. Verapamil. Answer B. Diuretics reduce fluid overload in pulmonary edema. Question 22. Which finding suggests digoxin toxicity? A. Hypertension, B. Green-yellow vision, C. Weight loss, D. Dry cough. Answer B. Visual disturbances are classic signs of digoxin toxicity. Question 23. A third heart sound, S3, indicates A. Normal finding in adults, B. Ventricular volume overload, C. Valve stenosis, D. Atrial contraction. Answer B. Ventricular volume overload reflects increased ventricular filling and heart failure. Question 24. Which risk factor is non-modifiable for coronary artery disease? A. Smoking, B. Obesity, C. Hypertension, D. Age. Answer D. Age cannot be modified. Question 25. Which medication is used for rate control in atrial fibrillation? A. Atropine, B. Metoprolol, C. Epinephrine, D. Lidocaine. Answer B. Beta blockers slow ventricular rate in atrial fibrillation.
Question 26. Which finding indicates worsening heart failure? A. Weight loss. B. Decreased edema. C. Increased BNP. D. Clear lung sounds. Answer C. Elevated BNP reflects increased ventricular strain. Question 27. Which rhythm shows sawtooth flutter waves? A. Atrial fibrillation. B. Ventricular tachycardia. C. Atrial flutter. D. Sinus tachycardia. Answer C. Atrial flutter produces characteristic sawtooth waves. Question 28. Which medication reduces afterload? A. ACE inhibitors. B. Diuretics. C. Digoxin. D. Beta blockers. Answer A. ACE inhibitors cause vasodilation, reducing afterload. Question 29. Chest pain relieved by sitting forward suggests A. Angina. B. Myocardial infarction. C. Pericarditis. D. Pulmonary embolism. Answer C. Pericarditis pain improves when leaning forward. Question 30. Which complication is most feared after MI? A. Hypertension. B. Arrhythmias. C. Weight gain. D. Infection. Answer B. Lethal arrhythmias are the leading cause of early death post-MI. Question 31. Which electrolyte imbalance causes peaked T waves? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Answer B. High potassium causes peaked T waves. Question 32. Which medication dissolves clots in STMI? A. Heparin. B. Warfarin. C. Alteplase. D. Aspirin. Answer C. Thrombolytics dissolve existing clots. Question 33. Which blood pressure reading indicates hypotension? A. 140/90. B. 120/80. C. 100/70. D. 88/56. Answer D. Systolic BP below 90 indicates hypotension. Question 35. Which ECG finding is seen in atrial fibrillation? A. Regular rhythm. B. P waves present. C. Irregularly irregular rhythm. D. Wide QRS. Answer C. Atrial fibrillation is irregularly irregular.
Question 36. Which medication should be avoided in heart failure? A. ACE inhibitors. B. Beta blockers. C. NSAIDs. D. Diuretics. Answer C. NSAIDs cause fluid retention and worsen heart failure. Question 37. Which assessment is priority in a client with chest pain? A. Pain scale. B. Blood pressure. C. ECG monitoring. D. Temperature. Answer C. ECG detects life-threatening ischemia or arrhythmias. Question 38. Which symptom suggests worsening aortic regurgitation? A. Narrow pulse pressure. B. Bounding pulses. C. Bradycardia. D. Cyanosis. Answer B. Bounding pulses reflect increased stroke volume. Question 39. Which drug is used to treat ventricular tachycardia? A. Adenosine. B. Lidocaine. C. Atropine. D. Digoxin. Answer B. Lidocaine suppresses ventricular arrhythmias. Question 40. Which lifestyle change best reduces cardiac risk? A. High protein diet. B. Smoking cessation. C. Increased caffeine. D. Low fluid intake. Answer B. Smoking is a major modifiable risk factor. Question 41. Which finding suggests pericardial effusion? A. Loud heart sounds. B. Narrow pulse pressure. C. Muffled heart sounds. D. Hypertension. Answer C. Fluid dampens heart sounds. Question 42. Which rhythm has no identifiable P waves? A. Sinus tachycardia. B. Atrial fibrillation. C. First-degree AV block. D. Junctional rhythm. Answer B. Atrial fibrillation lacks organized atrial activity. Question 43. Which medication lowers heart rate by blocking calcium channels? A. Digoxin. B. Diltiazem. C. Furosemide. D. Nitroglycerin. Answer B. Calcium channel blockers slow AV node conduction. Question 44. Which sign indicates decreased cardiac output? A. Warm extremities. B. Bounding pulses. C. Decreased urine output. D. Increased BP. Answer C. Poor perfusion reduces renal output. Question 45. Which complication is associated with long-term hypertension? A. Cardiomyopathy. B. Hypotension. C. Bradycardia. D. Hypoglycemia. Answer A. Chronic hypertension causes ventricular remodeling.
Question 46. Which medication is first line for hypertension with diabetes? A. Beta blockers. B. ACE inhibitors. C. Diuretics. D. Calcium channel blockers. Answer B. ACE inhibitors protect renal function in diabetes. Question 47. Which rhythm is treated with atropine? A. Ventricular fibrillation. B. Sinus bradycardia. C. Ventricular tachycardia. D. Atrial flutter. Answer B. Atropine increases heart rate in bradycardia. Question 48. Which test confirms heart failure severity? A. ECG. B. Chest X-ray. C. BNP. D. Stress test. Answer C. BNP correlates with heart failure severity. Question 49. Which symptom indicates acute myocardial infarction? A. Sharp pain relieved with movement. B. Crushing chest pain radiating to arm. C. Pain relieved by antacids. D. Localized chest tenderness. Answer B. Classic MI pain is crushing and radiating. Question 50. Which medication is first line for acute angina relief? A. Aspirin. B. Morphine. C. Nitroglycerin. D. Heparin. Answer C. Nitroglycerin rapidly relieves ischemic chest pain. You've just completed 50 cardiac Nclex questions explained step by step, one of the most tested and most failed sections on the Nclex RN. Remember, think priority, assess before intervene, and always connect ECG findings with clinical symptoms. Cardiac questions are not about memorization, they're about critical thinking. If this video helped you, like, subscribe, and share with another nursing student who needs it. More high-yield Nclex questions are coming your way right here on MCQs Master 101. Keep practicing, stay consistent, and go past that Nclex with confidence.